Up next, gaps in healthcare. In the presentation, we'll hear how specialized telemedicine can be different from traditional options and what that means for the individuals and those that care for them. Dr. Maulik is a board-certified emergency medicine physician who has practiced medicine for over 20 years and works with StationMD to improve the quality of care for the IDD population. David is the father of Edward, who has Down syndrome and is nonverbal. David used to provide full-time care for his son as a single parent. Edward resides in a group residence now, but the two are very close and see each other every day. Please join me in welcoming Dr. Maulik and David to Real Voices, Real Choices.
Hello all, and thank you for joining us. And it's an honor to be presenting here today at Real Voices, Real Choices. My name is Malik Trivedi. I am a physician and co-founder with StationMD. And today we will be presenting addressing gaps in healthcare and utilization of specialized healthcare for individuals with IDD using telemedicine. I'm honored to have David Earls along with me to be presenting, and I'm going to go through a few slides in the beginning and have David speak from his perspective as a parent and advocate. So first and foremost, who we are and what StationMD is all about. Our mission is really to elevate the quality of medical care for individuals with IDD, and that has been our mission from the beginning. We've been in operation about 6-7 years now, and we utilize telemedicine to deliver that care. It was founded by emergency medicine physicians. I myself am an emergency medicine physician, been practicing for over 20 years. And our physicians that work for us are all board certified physicians, but important to note is they are specially trained to care for this population. They undergo a specialized curriculum and ongoing education because it's an unfortunate issue in the medical community where a lot of physicians don't understand both the clinical and non-clinical nuances of this population. And I think that's critical. This population deserves to have specialized doctors to understand their needs and understand what their life is like to really deliver the best possible care. Currently, we are operating in 12 states and we cover a little over 30,000 individuals. These are just some of the organizations that we are members of. You know, we consider ourselves advocates as well as an organization that delivers this care. And we've been speakers at some of these organizations that you may be familiar with, and we're proud of our advocacy as well. This is just a busy slide that says people with IDD tend to use the ER more frequently than others. And this is for a variety of reasons. The other thing that's important to note is when they go to the emergency department, they tend to get admitted more frequently. A lot of it comes from the fact that, again, clinicians don't fully understand their needs, and the easiest thing to do is to bring them in the hospital and do a bunch of tests that oftentimes they don't really need. So the causes of frequent ER use and urgent care use, many individuals do have comorbidities, meaning other issues that make it more complicated. A fever in someone that has a PEG tube or maybe has some other underlying pulmonary issue is different than in someone who doesn't. The other aspect is oftentimes there's a lack of medical care otherwise. They may have a primary care doctor, but that doctor may not be readily available, or they may take a while to get back to them, or they simply may not have the same technology that we have to visualize an individual and feel comfortable with diagnosing them. And so oftentimes the only recourse is go to the ER, 911, or go to an urgent care. And that's not always the best care. This is just a screenshot of a real alarming study that, in today's day and age, talking about healthcare, we obviously have to bring up COVID. And unfortunately, it is still here and kind of making a second pass with this new Delta variant. But this was an alarming study that said that an individual with an intellectual disability, that's the highest independent risk factor for contracting COVID-19 and dying from COVID-19 outside of age. That's a real troublesome fact. And quite frankly, I'm alarmed that this study didn't get more press. Anything we can do to keep this population safe in the light of this pandemic, I think we should, because it has really adversely affected individuals with IDD. So, the ER experience is tough for anyone. No one wants to be there. I work there and don't want to be there often. But, for someone with sensory issues or maybe he's nonverbal, it's especially traumatic. I call it the trauma of transport. Just getting to the emergency department is difficult. Sometimes requires specialized transport. Often, they have to go with either a family member or a support staff. And of course, again, exposure to infection. Right now, if you want to catch COVID, that's the place to go. It's in the hospitals, and the hospitals are busy, and they're overwhelmed in many instances. And so anything we can do to mitigate going to the hospital or into the healthcare setting right now, I think we should. Of course, it's very disruptive to an individual's routine. You're going to be there for hours, even for simple things. And I put in here missed medications. Oftentimes, in my history working in the ER, I've seen individuals come just for a med refill because that's the only place they can go. So, my colleagues in the ER are brilliant. They're great, but they unfortunately don't have any specialized training. So, aside from the trauma and the exposure, the care that they're getting isn't necessarily from someone who really understands the needs of an individual with IDD. On top of the suboptimal care, they often get tested because that's an easier thing to do. If someone's nonverbal, not talking, they say, well, let me get a CAT scan, make sure something's not wrong, and they get hospitalized. So it's suboptimal care, and of course, it's expensive care. So challenges for provider organizations that are tasked with caring for individuals, they oftentimes have staffing issues. There's a caregiver crisis in this country, and anything we can do to support those people that support the people we care about, we should. And individuals do have complex care needs that require, oftentimes medical questions to be answered. And this just speaks to some of those issues that staff have to deal with in terms of turnover. An individual gets frustrated if you're sitting there. Anyone would for 6-7 hours, and it's difficult. So a little bit about telehealth. Telehealth, I think if there's any silver lining to this pandemic, it's been that telehealth has proven itself as a viable modality of delivering healthcare. You may have it through your own insurance. I would argue the value of telehealth is even greater for individuals with IDD or those who have issues of transportation or have complex medical needs or can't get to a specialist when they need to or have a real tough time getting to the hospital or ER or urgent care. It's tough. So having that ability to bring the physician or clinician upstream to the individual, I truly feel, whether it's StationMD or not, this will be the standard of care. The analogy I give is that when is the last time anyone's been to a video store to get a video? Well, now everything's streamed, and it's just one of those technologies that's disruptive. It's a better way of doing things. It's a cheaper way of doing things. And I think it's most important, individuals want it. They don't want to go to the ER if they don't have to. So, the benefits of telemedicine, of course, we can expand access safely. It decreases costs. But most importantly, I think it improves the lives of individuals and their families to allow them to live in the community and safely and knowing that there's a safety net. There's someone they can call if they need it that's available within minutes. There are no geographic impediments, and we can be in any part of any state as long as there's a cell signal or a Wi-Fi signal. Our service is available 24 hours a day, 7 days a week. I did emphasize that our docs are specially trained, so I do think it's not a substitute. It's better care oftentimes. And we have access to individuals' medical records. We create our own where we document everything, but we're also able to tap in individuals' records if they have access to those. I do want to emphasize two things. So we are not there to replace a primary care doc. On top of that, we augment the care. I may see someone and then let their primary care doctor know that I saw him at 2 a.m. to coordinate care. And the other thing is to understand the limitations. I obviously can't suture a wound over a virtual consultation. If someone needs a procedure done, there are limitations to what you can and cannot do using telemedicine. And at StationMD, if we feel the visit isn't as good, if not better than a real person visit, we won't do it. We will send the individual out to the hospital, get appropriate care. I just want to real quickly talk about our work with the state of Missouri. They've been phenomenal in supporting this, specifically the Missouri Department of Developmental Disabilities. Anyone that's on the Medicaid waiver, there is no cost to utilize our service. You can find information on their website on how to utilize it, and I'll let David speak a little bit about his experience on that. But it's been a success. The state has renewed our services, and we're really proud of the work we're doing, but especially proud of the state's commitment to this population and providing this specialized telemedicine service. So with that, I want to introduce you to David Earls. He has been gracious enough to join us today and just give his perspective as a father of Edward and also as an advocate. So it's all yours, David. Thank you.
Thank you, Malik. My son Edward is 35 years old. He is nonverbal Down syndrome. He has had, in the course of his life, been treated for leukemia and open heart surgery. To say the least, he's still terrified of going anywhere near a hospital or a doctor. And so now let's step back a year when we knew a lot less about COVID than we know right now. Edward was, I got a phone call one afternoon. Edward was running a temperature, his nose was running. They thought, the staff felt we should take him to the emergency room. He might have COVID. Luckily, well, they asked me to come and take him because staff have not had very good luck taking Edward to, because he rebels. He doesn't cooperate. So in these kinds of situations, they call me and I take him. Obviously, I'm going to do anything I can for my son. So I got a phone call telling me to come and take Edward to the emergency room because he might have COVID. By the time I arrive at his residence, they have conducted a StationMD call. And Edward, as I said, had a runny nose. He had some symptoms, but he didn't have the key COVID symptoms that would have indicated that he needed to be hospitalized. Because we were able to do a StationMD call, we did not go to the emergency room. Had we gone to the emergency room a year ago, Edward would have gone into quarantine for 14 days, and I would have gone into quarantine for 14 days, except who knows where, who knows how that would have happened. We were able to conduct the StationMD call without disrupting the staff. We were able to do it without subjecting Edward or me to 14 days of quarantine. And the StationMD doctor examined Edward, said, let's see what happens overnight. And if he still shows symptoms tomorrow, then we'll talk again. Luckily, overnight, as the StationMD doctor had predicted, Edward's symptoms disappeared. He was fine. Everything worked out. Edward has now had 3 separate StationMD situations over the past year, every one of which has prevented a trip to the emergency room. As Malik pointed out, when you go to the emergency room, you may not get the best doctor available. And unfortunately, in Missouri, which is not a state in which every doctor takes Medicaid patients, you're limited by your choice of providers. We've had a number of physicians through the years with Edward since he's been on Medicaid, and some of them, quite frankly, were not very good. They hadn't been trained, as Malik said, they had not been trained at all in developing with IBD. And they just, I don't know why they were taking Medicaid patients, except maybe they couldn't get patients anyplace else. What we've had with StationMD is the very highest quality of physician care that we could hope for. This makes a huge difference to this population. So everybody has benefited from this, this reaching out to StationMD and StationMD reaching out to our population. When I walk in the door at White Oaks, I'm going to say that there are 6 posters on different walls through the building with the StationMD phone number on it. So the staff have now been acclimated completely to the idea of calling StationMD first. Don't go to the emergency room first. Call StationMD. This works for everybody. This doesn't disrupt the staff. It doesn't disrupt the residents. It works.
I really appreciate those kind words, and you know, I think what David kind of the scenario he depicted is something that we see often, and I'm sure if Edward could verbalize what he, you know, who wants to go to the ER and sit there for something you don't have to, and to me that is the best part of this, is letting Edward do what he wants, and not taking him away from, you know, his life. Because you or I probably wouldn't go to the ER for these things. Why should someone that has an IDD diagnosis have to do and suffer those inequalities? I'll call it inequalities, because for me, I think the fact that you mentioned that not every physician really understands this population, and we want to provide the best possible care. And thank you for your story. I really appreciate it. The other thing I'll add is that we are available, our physicians are available for non-emergent issues as well. Med questions, refills, minor issues like constipation, if they're not addressed properly, turn into bowel obstruction later. So it's a solution and service for the individual, obviously, to provide the best care, but a resource for family and staff. Thanks again, David. Really appreciate it. I think I have one or two more slides, and I should be finished. I just want to give you guys a little bit of idea of the outcomes. Close to 90% of the calls we get, we are able to keep the individual in their home setting, meaning we don't have to send them out. And then I think this slide shows some of the common reasons that we get calls. Obviously, medication issues is big, and COVID, contact with exposure, but rash, UTI, cellulitis, vomiting, abdominal pain. The blue are the ones that we keep in place. The gray are the ones that we send out. And I will say that if we do send someone out, because obviously we can't treat everything, we will call the ER in advance and say, hey, John Smith is coming with leg swelling. He just needs an ultrasound for his make sure there's no clot in his leg. Let's not do a CAT scan. Let's not go crazy with blood tests. Try to get him in and out if you can. I know you can't always do that in the ER, but let's make this visit as least traumatic for the individual as possible. And oftentimes it helps expedite the care. And for me as a physician, the gold standard is when another doctor calls me and tells me, and it also lets that physician send that patient back home knowing, hey, at least someone's going to follow up on that, which as David alluded to, sometimes they don't have doctors that really understand this population. So that's another aspect of StationMD that we provide. That is it. I want to thank everyone for listening, but I especially want to thank David for taking the time and for kind of giving a personal viewpoint of our services. So thank you, David. And if you guys want to learn a little bit more about our organization, it's stationmd.com, and you can contact anyone on this care team. And I also lastly want to thank everyone for the great work they're doing to ensure the care for this population. Thank you. And thanks again, David. Appreciate it.
Have a question for our presenter? Submit questions in our video chat and the presenter will address as many as possible.
Oh, I guess I am on. Can everyone hear me? I hope everyone can hear me. I can see some of the questions in the chat, and I will try to address them. So first of all, thank you guys for the opportunity. I hope this is working. I know we all miss kind of being there in person. So one of the first questions I see that's popped up regarding Missouri. Yes, in Missouri, any individual that's on the waiver has access to this service. And if you go to the Division of Mental Health's website, you can find information. There's no signing up. You're automatically enrolled. And I don't know. I'm hearing that you can't hear me. Oh, you can hear me. Okay, good. So yeah, if you're on the waiver in Missouri, you can utilize the service. There are some questions about flyers. Yeah, I am absolutely happy to provide those. I will have the production control put my email into the chat so you can contact me about learning more, and I'm happy to send you a flyer regarding it. We are in other states. I know there's a question about Washington State. We are not currently there. I think it was Washington State. We're not currently there, but we are happy to engage with your organization or speak to your division of disabilities. They're all different in different states, because I do honestly feel that this is a really beneficial model of delivery, and will be the standard. But especially now, given the COVID crisis and given the fact that there are a lot of challenges to receiving care for this population, it is very, very beneficial. And we are happy to talk to anyone, present our solution. The real issue is making sure that the state sees the value and that they can reimburse it. We do work directly with provider organizations that we can contract with. So there's many different modalities. Probably the easiest thing, like I said, would be to contact myself, and then I can direct you in the right direction. I will say that Missouri has been fantastic, but there are other states that are really looking at this as a viable means of delivery, and we are also looking to expand beyond that waiver population. And we're open to very different models of delivery of this, different models of reimbursement. But I think at the end of the day, what we're finding is for the individuals themselves, for family members, or anybody, whether you're a formal or informal caregiver, this is just a real valuable resource to have. So that way that you are not really, as David mentioned, really struggling with sending people out to the emergency department. Outside of that, okay, I see from Washington State. Yeah, I'm happy to do that. And I think it's from Adana Obermeyer. If you have any connections or contacts that I can reach out, otherwise we can definitely reach out on our own. I do find that some states, they get inundated with questions and they look at us as just another vendor. So these are some of the challenges, but I'm happy to reach out to and speak to whoever needs to get this service to your location. But again, if you want to contact me and give me any more information, I will definitely follow up on that. Wondering if there's any other questions here that I may have missed. I don't see anything specific here. But I do really think that, can StationMD schedule doctor's appointments? So we are there on a 24/7 basis that we're needed in an urgent situation. It's not a scheduled type thing. So if you need our services, you contact us, and when our physicians are on all the time. Now we do scheduled visits for behavioral and psychiatric evaluations, because that's a big thing that we found is trying to get an individual to a psychiatrist is really challenging, no matter where you are in the country. So we do have a separate division where we do scheduled visits for those. But in general, we are there to answer any question, address any issue, and really visualize the individual and provide that care all the time. It doesn't even have to be a scheduled type appointment. So, and again, that's my contact information. Please feel free to contact me. And really, I want to thank everyone for giving me the opportunity to present this. And again, also want to thank the state of Missouri for providing this service to the individuals that they are tasked with caring for. So, I can give it a minute or so if there's any specific questions, and hopefully we will be able to meet in person at some point and get beyond these virtual meetings, because it's a little tough to tell who has questions, and it's nice to see people face to face. And one thing I'll address is one of the comments is the problem in the emergency room is that they wouldn't run any tests on my nonverbal son because he didn't appear to be in pain. I want to emphasize that our physicians, aside from being carefully vetted by us and being board certified, which I mentioned in the presentation, they go through a very extensive curriculum to understand both the clinical and non-clinical nuances of individuals in this population. I'm probably preaching to the choir, but most doctors don't really understand a lot of these issues that this population faces clinically, let alone what they need, what families need, what the challenges families have. If you have someone who's nonverbal or has sensory issues, taking them into a chaotic emergency room for just a simple issue, it's really challenging for everyone. So, I just want to emphasize that the ER is not the best place for this population at all. One of the questions about Florida is to get mental health, and that's outside of Florida as well. It's tough. I will say that sometimes having family members and advocates reach out to the division or reach out to somebody, we're happy to take it from there. But we feel this is a model that will work in any location. In fact, has even more value in places where they're rural or you can't get to a doctor, or even urban areas where it's really challenging to arrange transportation. So. And also thank you everyone for the kind words. I really appreciate the opportunity, and also it's good to be in a community that I think is collaborative. If it works in one state or one area, I feel that other individuals talk and they say, okay, well, this is something that we can replicate in Florida or Washington or other locales and locations. Yeah, and one of the comments was it took 8 months to see anyone, and that's the thing. The beauty of our service for at least the mental health and the behavioral and the psychiatric is we can schedule something immediately. We have a psychiatrist ready to evaluate. So. One of the questions is this available through insurance providers? We are working with some payers. Again, it's really, since most of this population falls under Medicaid, it's state by state. Every state's unique, and it really varies in terms of that. And then one of the questions also was elaborate quickly on the behavioral health division. So the behavioral health division it's for scheduled psychiatric visits because people can't get to them. So we would set up a block of time where you would get a half hour, an hour to get the evaluation, all done via telehealth through our IDD trained psychiatrist. So and again, I can send more information to that if you want to contact me. And then someone is asking my contact to the resource manual. Absolutely. Please feel free to add my information.